All right, looks like we are live on our YouTube channel, and I want to welcome everyone to the Wednesday, February 3rd committee meetings. And we'll start off with Health Services Committee and Chairperson Handel.
Good evening, everybody. We are opening Health Services Committee meeting at 6:10 p.m. We have several agenda items. We have with us tonight Nathan Fredenberg.
We can't hear you, Patty.
Patty, let me stop you 1 second. Whoever's not speaking, please go on mute. There's a lot of feedback. We can't hear Patty.
Nobody has ever said that before.
I'm on here now.
Are we good to go?
Yeah, try again.
Okay. So we have with us this evening Jason Fredenberg from Mental Health, and we also have Tim Kaplan here. Jason, I know there are a couple of items on here that you might have answers. If you wanted to speak about the Spring County resolution as well as the mental health resolution, before we get into them. No?
I can't hear.
Jason, I think that was to you, Jason, but somebody's still not on mute. I'm getting feedback from somebody's speaker into their microphone.
Charlie, put it on mute.
Jason, did you have anything to add or any
can you hear me now?
comments on the resolutions? Yes, I can hear you.
Okay, sorry. I've had when you went live, my whole screen changed and I've had trouble. So I'm sorry. The question was, what was the question that you had for me? I was struggling with the technological stuff.
Well, the first four resolutions have to do with the mental health department. So we just wanted you to give us a little bit of insight into them before.
Okay, sure. So, right. So they're the standard contracts for those agencies that we renew every year. The thing that's a little different this year is that there is the notice at the end of each one that talks about the 20% withhold from the state. So as I understand it, the state is withholding that 20%. And we are directed to pass those monies through, reflecting the withhold. But if things change with the budget, or there's the additional monies that come in where the state changes that and reduces that withhold, then this since these contracts are for the actual full amount, then we would be authorized to release the remaining amount that they would be due at that point.
Jason, does that require us then to fill out additional paperwork for the remaining funds if they don't withhold 20% at the end?
No, this is for the full amount so that we don't have to go back and do that again.
Okay.
And do you want to speak a little bit about what is going on in mental health these days?
What you mean specifically with the clinic, or are you talking about the state on the state level with the withholds?
No, the county level.
The county level, yeah.
Still working remote.
Right, yeah, we are, at this point, we're working remote. We're looking at the last few weeks of working remote. We've set a target date of going back in March, which I think most of us are looking forward to. Most of the staff has been able to be vaccinated through New York State Office of Mental Health. They were able to offer vaccinations to staff members of OMH licensed agencies like ourselves. So most of us got our second vaccine within the last week. Some of us still got their first vaccine this week, but by the end of the month, we should be fully vaccinated. And then we're looking to return to the clinic in March. At that point, we're still, while we plan to have all of the staff back on site in March, we're still planning to phase in in-person sessions with our clients. So we're still going to perform telemedicine. We're working out a system where I could share details with you if you want, but basically we're going to kind of split the staff into two different teams, and one team can see people on site in person one week, and the following week they would see them remotely, just to help continue to reduce the exposure and to keep our clients safe. We're the ones that are vaccinated, but to help keep the clients safe for as long as we can. So we're going to try to do that. But otherwise, I think most of us are quite excited to get back on site and to return to that state. So we're working out those details right now.
Thank you.
But we remain quite busy. Our numbers are pretty steady, as they have been for a year. So, you know, since we went remote back on St. Patrick's Day. So.
Anybody have any questions for Jason?
Patty? Jason, can you hear me? It's Mike Buelich.
Yeah, I can.
Jason, with this reduction at the state aid level, I know it's pass-through funds, but on the non-residential programs, what is the dollar amount for needed services that we would have to contribute to these providers as a county?
Nothing changes with what we contribute. I think that as I understand it, I believe that you know, counties have the option of making up the 20% that's lost to these withholds. But I know with COVID, the way everything is, I don't know if any counties are actually doing that. So I don't think there's any additional change or cost to the county.
Okay, so right now we're not actually on the cuff to make up that difference in the 20%.
Correct.
Okay, thank you for that clarification.
Yep. And I've been working with the different agencies about how these cuts, these withholds, we're told to call them withholds, are impacting services. And at this point, most agencies have been able to squeak by without reducing their services, but we're on the cusp of them having to start to reduce some of the services that they are offering, which is, you know, really, really unfortunate, because as you can imagine, the need is really great.
Thank you.
Anybody else have anything for Jason? If not, thank you very much, Jason. Kim Kaplan, did you want to kind of give us an overview of what's going on?
Good evening, yes. So as of today, 129 active positives, 2,334 total positives. New positives today, 22. We still have 23 in the hospital. We've had 62 deaths. Residents on quarantine, 252. And our rolling average is 6.2%, our 7-day. And just for perspective, it wasn't very long ago. As of January 7th, we had 400 active positives and 11.6 for a rolling average. So while it's quite a large improvement, you know, we want to really work hard to stay improving.
Great. Thank you, Kim.
Thank you.
All right, first resolution, authorizing contract.
I had a question for Kim.
Yeah?
Kim, Tommy Hobart. Just wondering how the whole scholastic sports with the students is going. As you can imagine, I've had parents, students alike, calling about this. And I've even talked with coaches. And to have like this 4% rule of running average or tally, it's just, I've done some research. The guy who come up with this formula, I mean, he's a retired epidemiologist, you know, and the governor in his typical fashion here couldn't make a decision, and seeing he didn't want to take the brunt of it. I mean, the counties couldn't manage themselves through this whole pandemic, but, you know, now he's letting us manage ourselves to do sports for kids. I think that these kids, you know, it should really be reconsidered. It's healthier for them. You know, the idle time is a devil's tool, as they would say. You know, these kids, it helps with their, you know, their critical decision making as far as like plays. And I mean, they're willing to do anything, even if it was a Zoom or a webcam. in the bleachers with no bleachers, you're looking at 30 people in a gymnasium tops. That's basketball. I just think it's something that should be reconsidered here. I mean, because whatever it is, the 10 districts that we have in the state, we compromise, or we're comprised of the other counties. So you're looking at like 8 to 12 counties. And for us to get pulled in with all of them, I don't really think it's not fair to the kids. And I really don't think it's rational. I mean, how long, I get it, it's real, but how long can you run from this thing? If the kids are tested, they're doing everything. And the thing is that gets me is, I get it, it's a public school, it's taxpayers' money. So the governor's kind of like saying, voila, you know, he passes the buck on to us. But yet in private leagues, you can pay a fee. My kid's been playing soccer right along with spectators, one parent allowed. There's no 4% running average. I mean, it looks like nothing against you, but kind of a cop-out. Is there any way that this could be reconsidered? Just putting it out there on behalf of my constituents, other people of the county.
Okay. So the restrictions that you're talking about, meeting the metrics to be able to play, which we had talked about, the 4% 7-day average, hospital capacity, hospitalization rate, and also any kind of epidemiological factors which would really make it dangerous, you know, a very virulent strain of COVID, for instance, something like that. All of this pertains to the high-risk sports, what have been designated in New York as high-risk sports. So not all sports. They stratify high risk, moderate, and low. So this is only talking about high risk. And part of the conversation is that the schools have really, really been working hard and really struggling to stay open and in person. But I do understand the needs of the kids and how it contributes to their growth and development and also their school experience. So what we're talking about today, and there is nothing finalized, is that they would be able to do with some controls and constraints, in-person training, inter-school, within their own school, with some controls as far as testing and as far as, limiting the number of people participating at a time and making sure that we knew everybody who was part of the practice for that day, but that they can do some training and practice in person.
Okay, I get what you're saying as far as like in person and in the school, but it comes back to, the whole matrix. We don't have a hospital in our county. There's other towns within our county, obviously, and neighboring counties that also don't have a hospital. I mean, you could have one outbreak in an assisted living home like it happened in the state where you still can't get the true numbers, and that'll blow that 4% rule out the window. I don't think it's inconceivable to have, like 4 different schools, just players. You could have 2 games going on in 2 different gymnasiums with no spectators, and it's no more congested than a restaurant down the street. I mean, and to say basketball or volleyball is high risk, I'm agreeing to. I understand what you have a job to do, and I respect that, but it doesn't make sense to me. I'm not talking about wrestling or, but if the kids are tested and they're screened just as everybody else going about everyday life, it's kind of common sense. That's all I'm saying. I mean, I thank you for hearing.
Okay, thank you. I do understand where you're coming from.
Yeah, and that was done with discussions with the school districts as well. So it wasn't, although Kim had final say on this, it was not, she didn't make that decision on her own, or certainly after one conversation either. And I know I did receive several emails back from school superintendents who were very thankful for public health and their communication with the school districts. And I think we're probably going to see that once again with being able to open up for practices that will then allow these kids to play inter-school sports with other schools as long as they have so many practices, the required number of practices, I guess it is, before they actually start that. So thanks for leaving that line of communications open as well, Kim. And Patty, if I could, just one quick word here. I know everybody got the email today that our vaccine form was put online today. That again was a lot of work from Kim, Penny, Dan King at the EOC, Warren, Cathode Ray. It was a conglomerate there that worked on getting that thing up and running out to the public so that it was functional for our purposes. So I've seen a lot of good comments just in the few hours that it's been up. And I think the last time I spoke with Warren, we were at about 750 people were already registered just in a couple of hours. So thanks for helping out with that, Kim. I know it'll help you guys as well.
Kim, it's Matt Lavera. I just have a quick question. I had a concern regarding a person with developmental disabilities and getting the vaccine. Would you suggest they're not part of the OPWDD? How would they go about getting a vaccine, with a person with a disability like that?
So this conversation has just started with New York State, and just like with the seniors, they're starting with who they feel is the most vulnerable, which is the congregate housing. So that is all evolving really right now. And I think we should have more information within the next few days. So this is a person who dwells in the community, from what I understand, and they have not made the vaccine status for that person clear, but that is a very active conversation right now. So we should know soon.
Okay, great. If someone could email us with information about that, that would be great.
Okay. When that becomes available, I certainly will.
Thank you.
Matt, you said there were Kim, you said there were 700 people signed up already?
On the
that.
website. Mm-hmm.
As of we opened it up this afternoon, correct?
Yes. Yes, Harry.
Okay, so we got 700 people from there to now. Okay, thank you.
Anything else for Kim? Thank you very much, Kim.
Thank you. Have a good evening.
You too. Okay, first agenda item, authorizing contract, Twin County Recovery Services, Inc.
Hobart,
Hobart, second.
Lavera,
all in favor? Aye.
Aye.
Wait,
Aye.
discussion. I see that they're raising their budget this year, that they're taking from Greene County. All I've heard on the news this whole year is that substance abuse users have been having problems because services have been cut. So why is the budget going up? I know we're going to lose 20% from the state, but why their services are going down.
Jason?
Yep. At this point, their services are, as I said, they haven't gone down yet. They're poised to be reduced based on what happens with this 20% withhold. Not sure if that answers your question. I'm not sure what.
Okay. Yeah, not really. Well,
help me understand.
I can't find I'm looking for my paperwork right now.
Okay.
But I believe what we're paying them is going way up. Oh, here it is.
Jason, is that just the first quarter, the increase? And we're
Yeah.
Let me see if I could find it on my screen as well.
Yeah.
Just bear with me here.
Last year we paid $661,000. This year it's going up to $680,000.
I see. Okay.
Yeah, my understanding is substance abuse services, all the in-person was cut. So basically the budget should be going down, not up.
I'd have to go back and I don't have an answer for that exactly right now.
Okay.
I'm sorry about that. I'd have to go back and look more into that. I do know that these are the budgets that we review and that my fiscal officer goes over as well. I can't put my finger on at this moment what that increase is. I'm sorry about that. But I
Okay.
can find out for you and come back to you with that.
Okay.
I would like to have that before we vote on it at our full meeting, if possible.
Let me see if I can find something out while we're meeting here. Let me see what I can figure
Yeah,
out.
we have a motion and a second. Can we just table it until for the legislative meeting till we get clarification? Or the next meeting?
No. Procedurally, you would pass it tonight pending final update at the full board meeting
Okay.
at finance. Forgive me.
Well, but we amend that then, correct, Sean, where we could vote to
Finance would have the ability to amend the contract.
correct.
All right. Is that what we're gonna do?
Yeah, I'm all right with that. Greg, what do you
Yep.
think?
I'm going to vote nay.
You're gonna vote nay. I will support it, but pending we get the clarification from Jason by our full board meeting or by finance committee.
I'm
Seems
working
fair
on
enough.
getting an answer for you right now.
I'm with you.
It's because they received a COLA adjustments for cost of living.
Who received the COLA?
I believe it was the Twin County staff, I assume. Let me find out.
It can't be raises, right? I mean,
I would hope not.
there's a hiring. I mean, we're looking to holding people so you try and save jobs.
Well, if they got COLA, it could be in raises.
Okay, so it came both Twin Counties and MHA, which is the other contract.
Are these through collective bargaining?
No.
No.
I would have to go along with Greg then.
Well, they're basically a vendor. They're not one of our unions or one of our
No.
employees to begin with.
Correct.
For procedural
And that's-
purposes, I would ask that we approve it here in health and then make any adjustments in finance after Jason has more time to evaluate the $19,000
Yeah.
increase. And
What I'm being told is
other services are being cut.
What I'm being told is that it's not at our discretion that the state awards it to them for the cost of fringe increases.
So Jason, what percentage of this contract would you say that was meant to be used for people to be able to get these services, but because of COVID, some of these services didn't occur for them, which Greg was stating. And so next cycle here, we're going to pay for an increase to the contract. Okay, but we don't know if the people are going to get the services. So we're paying people their paychecks and their fringe benefits, and the end user, the addict, or whoever needs the assistance, the service, isn't getting the full service. Is that what happened?
I'm sorry, I couldn't hear the last part of the question.
My question is that are the people who are looking for the services able to get the service right now, or has that been hampered or cut back because of pandemic?
No, not at this time. And this is state aid money. We aren't, the county isn't paying any of this. This is state aid.
Yeah.
The county shares $30,000.
Yeah, the majority of this money is pass-through money. We receive it as a
Correct.
revenue and then expense it out to the two agencies.
But Sean, we're advancing quarterly payments in the hope that we're going to get reimbursed. So what if we don't get reimbursed the 20% back of the original payment?
Well, the way the contract
No,
is being proposed, we would not pay the full value of the contract during each quarter, awaiting final decision on full payment. If the
Correct.
full 20% is going to be cut, we would not have paid that out to begin with.
That's the 18,441.75 that's in the resolution.
Right.
That's the 20% reduction.
Right.
And what happens
Yeah, we
if the
can't
state doesn't
change
pay
this-
that? Do we have to pay that then?
No.
No,
And we can't change the pass-through amount either.
yeah, this is
And
not.
we
money
receive the payments.
This
Right.
is state,
We
this is
receive
state money
the,
that's being thrown through our ledger, if you will.
Okay.
Yeah, but in the contract, Sean, it's stating our quarterly payments are not reflecting any reduction potentially of, say, of this one, 18,441. We're paying the full shot quarterly payment of the contract.
But you're only paying that quarterly. I mean, we have then second quarter, third quarter, fourth quarter to make that $18,000 adjustment. So from a cash flow perspective, this in theory keeps them whole, because you're about to get a full budget now from the state, and then within the next 30 days or so, and then we'll finally see how that 20% is going to be funded out. If in fact it is going to be cut as proposed by the state budget, we can make the reduction later in the quarters.
Okay, all right.
Yeah, I'm okay with that then.
I got, so the state, if they can't make it in the fiscal year, it's not budgeted, we're not on the hook for this.
We are not.
Okay.
This is pass-through money. If we don't get it, we
Okay.
don't pay it out.
Okay. This
All
is Davis, as long as they don't hold us accountable for that 20%, I will vote yes.
Right.
Well, yeah, but we're not gonna lose money.
yeah, and
I'm
I just
sorry.
want to clarify, we're actually only advancing 80% of each quarter. We're
Okay,
holding back the
right.
20%.
Right.
Okay.
Okay, so I had a motion by Hobart, second by Rivera. All in
Correct.
favor?
Aye.
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 Is there a dissent?
No, okay, that's carried.
Yeah.
Thank you.
Authorizing agreement, Greene County Mental Health Community Services Board and the Mental Health Association of Columbia and Greene Counties, Inc.
Davis.
Hobart.
Davis, Hobart, all in favor?
Aye.
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 That's carried. Authorizing agreement, Greene County Mental Health Community Services Board and Northeast Parent and Child Society.
Hobart.
Davis.
Rivera, Hobart, all in favor?
Aye.
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 That's carried. Authorizing agreement, Mental Health Association of Columbia Greene Counties, Inc., Youth Clubhouse.
Hobart.
Rivera,
Hobart, Rivera, all in favor?
Aye.
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 That's carried. Budget amendment, Greene County Public Health Department, New York State Health Foundation Grant Funds.
Davis.
Hobart.
Finger.
Davis, Hobart, all in favor?
Any,
Aye.
Aye.
any nays?
Aye.
Are there any nays?
No.
No, there are not.
Thank you.
Okay, that's passed. Budget amendment, Greene County Public Health Department Performance Incentive Initiative Award, Year 8.
Davis.
Hobart.
Davis, Rivera, all in favor? Aye.
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 That
Any
is
nays?
no nays. That is carried. Is there anything else to come before Health Services Committee this evening? I almost lost control, but Sean reined it in for me. Thank you, Sean. Okay, motion to adjourn?
Hobart.
Hobart, we are adjourned. Thank you, everybody.
Thanks,
Thank
Patty.
you.
You.
Mr. Buich, may proceed.
Hi, Sean. Coming to the podium. Good evening, everybody.
Evening.
Glad everybody was able to make it here. We've got first we're bringing county resources to live at 6:30, 6:40. We have two action items. First is appointing member to our Board of Trustees at the Columbia Green Community College.
Lavera.
Overbaugh.
Okay, any discussion on this? All in favor?
Aye.
Any opposed? So carried. Great, that's great news. She'll be great for that. Second one is appointing member to our Columbia Green Workforce Development Board. This is for Mr. Ronald Valentine. And he's to fill out a remainder of a 3-year term that'll expire in 2023. I need a motion on this.
Linger.
Overbaugh.
Linger, seconded by Overbaugh. Any discussion on this? All in favor?
Aye.
Opposed? So carried. We have a letter, a little informational letter from our Library Association here. Hopefully everybody got to look at that. There was also a letter sent, Pat, I believe you received that also in regards to Marlene Martin.
Yes.
From the Council on the Arts, requesting we look at bringing the full funds that we had cut back to her, and she, in that letter, she also stated as to what they're doing with the monies received from Greene County. I don't know if everybody received that letter, but I believe everybody should at least read it to understand it. And if anybody feels we should bring that back up for discussion, I'd be more than happy to entertain that.
Yeah, there was a lot of information in that letter that we had not received previously. So
Yes.
I would concur, Mike, that it's a good idea for everybody to take a look at that.
Yes, I took a look at that. I think we might want to change that.
I will agree that we could bring that back up in the following month's meeting. But I would also caution everybody also that this should have been brought to us 2 months ago by her.
Right.
So we had a better understanding.
Correct.
In my opinion, Mike, Chairman, in my opinion, the whole thing wasn't clear. It wasn't clear. I agree with you. It should have been brought to our attention months ago. If we known this information now, it would have been different. So I agree
Yeah.
with you.
So
I haven't received that letter.
Linda,
Mr. Bulich,
yes, Sean.
I would ask the parliamentarian to opine on the procedure to reconsider a previous vote. I believe that's within 30 days of the actual decision.
Can
Okay.
we
Mr.
bring it
Gardner?
to the floor?
Mr. Gardner, the reconsideration of a previous vote.
Can we, rescind the original resolution and then do a whole new resolution with a new amount?
I think you can within your 30-day period.
Well, no, I'm saying not even do a motion to reconsider, can we? rescind?
Larry's still on?
Hey, is-
here.
Larry,
Are you
would
talking
repeat
about-
the question?
Position, Sean?
Let Larry answer the question.
I couldn't hear. What's up?
Larry, the contribution to the Council of the Arts that was decided last month reduced the funding for one of the two grants.
Yes.
Now the board has received a request or an appeal from the council, and there appears to be support for the legislature to reconsider. However, I'm concerned procedurally of our Roberts rules or our policy to reconsider previous votes.
If we could rescind the original
Give me a second.
Is there an ability to rescind during the next cycle and then reappropriate?
Is it Rule 23, Larry?
Yeah, let me get in front of my eyes. Give me a second.
Because right now it's as amended.
Right, twice.
So can we rescind that as
Right.
a resolution and bring back a new one authorizing, agreement with Council on the Arts in the amount of $35,990?
Larry, while you're looking that up, for simplicity's sake, if you recall,
One second.
that was amended twice.
It was amended, and then it was just, it was simply, we have an adopted resolution is what we have. Okay, so,
Okay, so can we rescind that adopted
Right.
resolution and just bring a new
So this,
one?
our question is, from simplicity's sake, can we rescind the previous resolution and then reconsider a change?
Not even reconsider, just bring a new one to the floor.
give me a second.
Charlie,
Okay.
Charlie's muted over there.
Yes, I mean, okay, here, we're not talking about reconsidering. We would simply rescind the old resolution. We would need a resolution to rescind the old one, and then we would need a separate new resolution with a new number in it that's pleasing to a majority. So you'd have two resolutions on the agenda: one to rescind what has previously been adopted, and the other to adopt what you now want.
Does that need to be within the 30 days, though?
No.
Does that go to a weighted vote, Larry, or like a roll call vote, or is it a majority get passed?
Well, a motion to rescind requires a affirmative vote of 2/3 of the total members of the well, here, this uses our old language of 2/3 of the total members. We now have weighted voting. So to rescind what we've previously done, you'd need 2/3 of the weighted vote. Should that then carry by that 2/3 vote, you could then consider just a totally different resolution based on a majority vote.
Understood. Thank you.
Okay, so Pat, I think we can make sure every legislator gets that letter to review so they can absorb the information that was presented from Marlene. And I'd be more than happy to reach out to her and as this goes forward to chide her a little bit to make sure that we get this information in a timely fashion for our budget cycle. And I think this could have all been avoided in some way. There's still maybe some reservations from our legislature as to what we're funding there. But I think that this letter going to everybody for review and then discussion in the next month's committee meetings would be beneficial.
Next month, or have a second special meeting of county resources in February?
February. I say February, Mike.
February?
I would. I agree with you. We got to bring it back. I would do it sooner than later. I don't think
Can
I'd
it be
wait another-
done now?
I don't think I'd wait another month. We should have another, Chairman Bulick should call another meeting in the month of February.
Okay, can we call another county resource committee meeting to order before finance next week?
It would be week after finance.
The week after, can we do that?
Yes.
It could be that
Yep.
way.
Yeah, it could be it could be this coming Monday, the following Monday, either or.
We'll do it for the following Monday. That way people have the opportunity to digest it a little bit more.
All right. I did hear Legislator Overbaugh say she didn't receive, I believe we're having technical problems with transmission
It's just her.
of electronic data to her, so I'll get it out in the old-fashioned mail, unless Miss Overbaugh is going to be in the building anytime soon.
It's going to take some time. It's a lengthy letter. So everybody's got to go through it, take some time. It is lengthy.
Mhm. It's resolution 1321.
Okay. All right, we'll do that. We'll plan that for the following Monday. And we'll bring another committee to order on that day for County Resources to discuss this and then vote on an amended resolution. All right?
Thank you very much.
Anything else to come before County Resources?
Motion to close, Mr. Chairman.
Okay, we have Lennon to close the motion, seconded.
Arlington?
We are closed, thank you.
All right.
Thanks, Mike.
All right, Mr. Hobart, we're ready.
Thank you. Good evening, everybody. Everybody, I'd like to open up the Public Safety Committee meeting at 6:51 p.m. All members of the committee are present. The new jail update, everything that we have there, there's 10 proposed action items. There's new jail update beforehand, and everybody got their sheriff's report. But tonight, before we get into the action items, I have John Farrell, the emergency coordinator, on the call with us. He asked if he could say a few words and give us a brief report. So, Farrell, whenever you're ready.
Hey, good evening, everyone.
Good evening.
Under the covert operations, I just want to say that we've been managing the EOC room, which takes anywhere from 50 to 2,000 calls a day, depending on what's going on. The EOC call center staff comes from departments of the Human Services, Social Services, Probation, Public Defenders, Administrator's Office, Tourism, and Emergency Services. The emergency service staff, Danielle and Heidi, doing a lot of work assisting with scheduling, notification, and all-around assistance. The COVID operations, we have conducted 8 pods so far with a distribution of just under 2,000. The clinics for the firefighters are going on tonight in our lower multi-purpose room between 6 and 8. And Dan King and Penny Martinez are overseeing that operation. And I just like to say that these two people, what I see on a daily basis, trying to get ready for the next pod. It's just amazing what Dan and Penny both are doing, along with the staff that are coming from the many departments. Dan takes probably about 45 minutes to about an hour training our employees from all these departments. And it's amazing how they blend right in into the other classroom answering all those calls. So I just can't say enough. Calls for the month of January. I just want to say EMS was 508, fire 154, police 1477, and unknown calls was 701. This week with the current storm, winter storm that we had, I'm very happy to say that between the National Weather Service out of Albany, Central Hudson, NISEC, Emergency Management Office on the state level, the state police, on Sunday afternoon, I received a call from every single one of those agencies. And throughout the following 3 days, I was in constant communication, and it worked out very, very well. Real quick, the hazmat team and the technical rescue team, I'm currently working on their grants that we get annually. Both Columbia County and our county are working on doing training together for the hazmat team. And on the Ulster County and Greene County for the technical rescue team, I'm just happy to say that they're continuing to get the necessary training from the Office of Fire Prevention and Control. And the 2 fire coordinators, we're working together on the $150,000 grant that was awarded last year. Fire training currently right now, as I'm talking, all my fire deputies are doing a web with State Fire and representatives from the Office of Fire Prevention and Control, holding a meeting on discussing our necessary training. Starts in April through September. With the current EOC operation at my office, I expect this to continue. I'll be reaching out to fire companies throughout the county to see if it's a possibility to hold that training, those trainings in the beginning of April and May. I'm currently, just so you're aware, April 12th through the 18th is the National Public Safety Telecommunication Week. Randy and I are currently working on a plan to show our appreciations to our dispatchers of their daily commitment to the residents of Greene County. I'm also happy to say that tomorrow morning, the sheriff and myself will be meeting with officials from Montgomery County to review our Tyler CAD product. This is the second county that has reached out to us within the last year and a half. Fulton County came to us and they did decide to go with Tyler. And I think for that reason, Montgomery had reached out to the sheriff, and we'll be spending tomorrow morning with him. At this point, that's it, Mr. Chairman, for my report at this time. Any questions?
Any questions for John? Hearing none, I thank you, John. Kudos to you and your staff. Great job, and just keep up the great work that you guys do. Thank you for sitting in tonight.
Thank you.
Thanks, John.
What's that, Pat?
Nope, just said thanks, John. I got to tell you, I've been in fire and EMS, maybe not quite as long as John, but this county's come a long way, and it's kind of nice to see other counties coming to us to see what we're doing.
Absolutely. And one other thing, Mr. Chairman, I'd just like to say, during the snowstorm, I think the biggest headache that we had was a structure fire at midnight on Green Lake Road. And I just want to thank County Highway and also the Town of Athens Highway for plowing the necessary roads to escort those fire trucks to that scene. It was a working structure fire, and they did do a great save under some hazardous situations. So thank you.
Thanks, John. I'll make sure to pass that along. Everybody should have received the sheriff's office, his monthly report. I just received a text message from Pete. He just wanted me to also, he said it's saddened and a heavy heart to report that former sheriff deputy there, Ray Berg, had passed away today. So I'm just passing that along to you. That was not in the report, so I'm saddened to give you that news. This evening, I have 10 proposed action items. The first action item on here, or resolution.
Mr. Chairman, I wanted to give a brief update on the jail.
Oh, okay. Go ahead, Sean.
Thank you. I just wanted to let you all know that officially last week, the project has reached what's called substantial completion status. You can take that, literally, that the majority of the work is completed, and now we are in the process of identifying punch list items. The punch list items are being drawn up by by each of the contractors or the primes. SMRT is also drawing up its list, and then Pike, the construction manager, is also doing its list. So all of those items then will be combined and then will be worked through the remaining weeks of the project here. So we've gone from at the 2 weeks before meeting the substantial completion status. The project was really under construction 7 days a week, sometimes 2 shifts. Upwards to 160 workers at a time in the building. We are now approaching almost 600 days of construction. There has not been an accident. There has been no COVID issues. And as far as I can tell, nobody has even stepped on a nail. So we are very happy with the progress. And as we move through the punch list items, then the remainder or the non-construction work will now pick up. That includes the FF&E acquisitions, the fixtures, furniture, and equipment, as well as any future contracts. For instance, the medical services contract, which I've advised you of separately. So those things will continue. The furniture, which is, I'm happy to say, is all American made and on state bid, probably has an 8, perhaps to 10-week lead time. So we're looking at probably April for that to be all installed. This all then coordinates with the final CFC inspections. CFC has been down at the site numerous times throughout. There are not any known issues right now other than finishing up the details. And lastly, one of our construction trailers has been pulled, and the others will remain through the remainder of the contract. With that, though, I will also mention that at the last 2 jail committee meetings, we did talk and approve about extending out some of the work beyond final completion date that primarily has to do with landscaping and final asphalting. We made the purposeful decision in the fall not to do those services due to the incoming weather, and the fact that certainly from an asphalt perspective, there still remained considerable heavy equipment on site, and we felt it was better to delay the final installation of those until all of that equipment could be gone, so that we did not experience any failure due to heavy equipment being still on site. So there will be a need in the future to extend the Pike contract. That is being developed right now. But everybody, I have to admit, during the final weeks, I was getting nervous that substantial completion status would not be met. And I do have to admit that the prime contractors did bring in many additional workers and worked overtime, weekends, etc. And we were able to, in essence, meet the original substantial completion date. Then lastly, many of the change orders this evening are not technical change orders increasing the contractual amounts paid to the primes, particularly item number 7, which has multiple items. All of those expenses are within allowable allowances. If I could be verbose there for a minute, and I'll explain each one as we go through the resolutions. Thank you, Chairman. Unless there's any questions, we can proceed.
Perfect. Thank you, Sean. So see at this punch list that you're talking about, excuse me, the substantial completion, that's all CFC approved. I mean, they have to approve it before they can do the job.
No, the CFC doesn't really approve the bricks and mortar per se of substantial completion. They'll wait till we declare completion, and then they'll do a physical inspection of the facility, and then they'll sign off on the protocols and policies of operations at the same time.
Okay.
Yeah, the punch list is more the finishing of the garage, the glass that hasn't been installed yet, the floors in the hallways and the pods. Those sort of things are the punch list items.
A lot of those things you don't want to do when there's 157 workers still milling around. You want to do a cleaning, particularly when you get into flooring, VCT flooring, rugs. You want people out of the building before you commence that stuff.
I just didn't want another problem like the air evacuation system we had there. It was a rather hefty fee, and we know how that went down. But anyway, wanted to make sure we weren't, swimming in circles here. That's all. But thank you, Sean, and we'll get into the resolutions. The first resolution we have tonight is authorizing professional services with Barton LaJudas DPC space programming for evaluation of the new municipal building. Can I get a motion? Handel,
Linger.
Linger, all in favor?
Aye.
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 Anyone opposed? So carried.
Charlie, you're still on mute if you were looking.
No. Thank you.
I'm sorry, is that a nay vote?
No,
Okay, sorry.
I want to see this thing go.
A no to your nay. Okay, thank you.
The second item, authorizing the change order for Jack demolition, the old county jail facility. Get a motion on that.
Martinez,
Martinez, I'll second it. All in favor?
aye.
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 Opposed?
Good job, Warren.
So carry. Third agenda item here, authorizing change services, Asheville Incorporated, Green County Jail Facility. Can I get a motion?
Linger.
I'll make Linger, Hobart, all in favor?
Aye.
Aye.
Aye. Opposed? So carry. What's that? Fourth resolution is authorizing services, James Boy Incorporated, New Green County Jail Facility. I'll make the motion.
Second.
Martinez, all in favor?
Mr. Chairman, I'd like to explain this one.
Go ahead.
We had an errant vehicle, a non-contractor vehicle turn around in the site. I guess he was lost. And in his haste, he actually ran over a newly poured sidewalk and cracked the sidewalk. So I have to commend the sheriff's department. They were able to use GPS tracking and was able to ID the errant driver, and the company provided us with the damages, which is affording this change order tonight. This is not coming out of our pocket. It's coming out of the firm who had the errant driver.
Perfect. That's number 5. Motion second by Charlie. All in favor?
Aye.
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 Resolution number 6, authorizing services, James H. Incorporated.
Mr. 5, Mr. Chairman, number 5.
Okay, what I thought I said that, so I skipped one. Authorizing the services, James H. Malloy, New Green County Jail Facility. Handel, Martinez, all in favor?
Aye.
Aye.
Opposed?
We're getting a lot of background noise here. Does somebody have something on in the background?
I hear it. It sounds like my.
That would be Charlie.
That's Charlie's. He's off mute.
Like hell.
Number 6. H. Malloy Incorporated, New Green County Jail Facility. I'll make the motion. You get a second?
Martinez,
Martinez. All in favor?
Aye.
Aye.
Opposed? So carry. Number 7, authorizing the change of services, Jerson Construction Group LLC, Green County Jail Facility. You get a motion?
I'll make a motion, Thornton.
Jimmy Thornton makes a motion. You got a second?
why not?
Martinez on number 2. All in favor?
Aye.
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 Anybody opposed? So carry.
Yes.
8, authorizing the change
I'm
of
sorry.
service, Infrastructure Technologies LLC, New Green County Facility. You get a motion?
Martinez,
Martinez, a second.
Thornton.
Thornton.
mountaintop.
All in favor?
Aye.
Aye.
Anybody
Aye.
opposed? Carried. Number 9, appointing members to the Greene County Fire Advisory Board for
Lennon.
2021.
Lennon.
Made a motion at Lennon, second.
Dorrington?
Dorrington, number 2. All in favor?
Aye.
Aye.
Aye. Opposed? So carry. And the final resolution, appointing additional member to the county HAP. Make that motion. Second.
Second, Lennon.
Lennon, number 2. All in favor?
Aye.
Aye.
Opposed?
I'm sorry, who motioned the last one?
I did. On.
Okay, thank you. Hobart,
Hobart Lennon. Anything else to come before Public Safety Committee?
yes, Mr. Chairman, I'd like to give you 2 more jail comments. If you recall, I believe it was in the December cycle, we had a change order that we wanted to approve to get work done, and we had a maximum threshold where we agreed to pay no more than $150,000 across 2 prime vendors. I hope you all remember that.
Yep.
And then we left Mike with the authority to manage the 2 of those things. I can advise you that those are now completed, and rather than the $150,000, it was reduced to $131,600. So there was a slight reduction in that change order. And then lastly, again, when I look at the progress to date, the commencement or the meeting of the substantial completion status, I know we all hate change orders, but to date, and we think by the time we finish, change orders will represent about 1.5% value of construction. And that, I have to admit, is a really, really good number. Industry standards are anywhere from 3 to 5%. But not every project is as complicated as a facility like this. So I understand we hate the change orders, but all in all, we should be pretty happy. We're still running a surplus in the project. And I absolutely believe that there will be a surplus upon completion of the project.
That is good news, and I think
Great news.
I think that falls back on you, and also Brucey does a good job.
Yes, Mr. Heisler has been a very big asset to our efforts.
Absolutely. Congratulations, Sean. Well done.
Good job.
Yeah.
Can I get a motion to adjourn?
Wait, this is Davis. One quick comment.
Yeah, Greg.
On a news report dated January 21st, Governor Cuomo is tucking a measure into the state budget proposal that would amend state law by allowing counties to share jails. So unlike many of the people in the county who were telling us that it's legal to share jails, at this point, at this time, it is illegal for counties to share jails.
Yep.
I'd have to read that, Mr. Davis. I'm not going to argue with you. Note, I think most of this is unconstitutional because you give the governor executive orders and like a damn czar.
Yeah.
Whole legislative, your executive power, the power of the people and their voices to be heard. So
yeah, I'm just stating
I
that
get
at this point, it's illegal for counties to share jails.
Right. It's by the responsibility of the county, state constitution.
It shows we needed this jail.
Yeah.
Motion to adjourn.
Motion to adjourn.
One more comment. Just want to
Please.
say I did drive in the jail complex on Sunday afternoon. It was mid-morning, I'm sorry. And I got impounded by 2 sheriffs and their van. I was just doing a drive-through, but I'm just glad to see everybody's doing their job. They're supposed to do their security, and they were there. And they wanted to know what I was doing, and I told them we're just driving around the backside, taking a look. But I want to say, it seems like everybody's doing their job there, and things are going great. And I just want to commend everybody for that.
Great. Motion to adjourn.
Second.
That motion, I got a linger.
I'll second.
Thank you.
Chair was very comfortable, Harry.
I'm glad you enjoyed it.
You broke it in over here.
I think we need to have Mr. Martinez attend these meetings in person.
Ladies and gentlemen, I am going to conclude the live stream at this time.